I am Theresia. I am happily married for many years. I have 4 beautiful daughters and 10 lovely grandchildren. All my career I was employed at the University Hospital of Leuven. I worked in different departments and I ended my career in the Department of Ophthalmology, where I managed the Secretariat Medical Retina. As a member of the Ethics Committee, I am a patient representative. This means that I thoroughly read the informed consent and all other forms the patient has given access to. I mainly check if these documents are written in an understandable language for the patient, if it's clearly explained what the purpose of the study is and what is expected from the patient when he or she wishes to participate. For several years I've been a simulation patient for the Students' Medicine and Pharmacy. An acquaintance there told me that the Ethics Committee was looking for patient representatives. So I contacted the Ethical Committee and the chairman, Professor Casteels, invited me to attend a plenary meeting. After a few weeks I was accepted as a member. No, I did not have to follow any training. The role of patient representative is new since January 2020. And I was explained what is expected from the patient representatives. And I also attended some plenary meetings to see how the Ethics Committee works. It's quite a challenge to understand all medical terminology, and sometimes the assessment reports are expected to be in English. And then for all studies, the ethical, statistical, legal aspects are discussed and dealt with in detail, but I think it's very interesting. I try to empathize with being a patient as much as possible. Would I like to participate in this or that study myself? What are the advantages or disadvantages? What do I have to lose? Are there any consequences for my family if I participate? As a healthy patient representative, I go through the documents as objectively as possible, taking into account the hopeless situation of some seriously ill patients. Do they have any choice? Are there alternatives? That's difficult for them. In a certain study, which I found very burdensome for the patient due to the many visits, the duration of the visits, the serious side effects, the many questionnaires, among other things, I experienced that my input, together with the input of other Ethics Committee members, was important enough to approve the study only after major modifications. My advice is that as a patient representative, you should be prepared to make enough time to thoroughly read all the documents assigned to you and that you can form an opinion of these studies in a non-scientific way.